Nurses from all around the world were in Calgary this week in an effort to tackle some of today's most pressing health issues. To talk more about the conference that just wrapped up, we're joined by Zara Shajani, Associate Dean with the Faculty of Nursing at the University of Calgary. Zara, good morning.
Good morning.
So this was the first time this conference has been held in Canada. What was discussed?
I think a lot of the topics that were discussed were related to health promotion, public health, global health. And so we looked at illness prevention, disease prevention. We looked at health promotion, ways that we can look at our environment, the ways that we can look at epidemiology, policy, advocating for public health. And so there was a lot of health promotion, public health nurses from across 15 different countries. We gathered at the University of Calgary. We co-hosted it with Mount Royal University, and so it was a very powerful conversations that we had around global health.
Yeah, and how important is it to host and participate in these discussions?
I think very important because there's a lot of things that are happening across the world that are impacting not only just individual health, but as we can see, community health, population health. And so it's important for us to come together and think about, how we envision best practices across the world. Health equity is another one. There's a lot of things that are happening, and so it's important to understand what's happening across the world, but it's also important to understand the basic principles of public health and global health.
And the conference took place at an interesting time. Alberta is seeing a resurgence of measles. What were the key takeaways in relation to curbing infectious diseases?
I think the most important piece is ensuring that people have accurate information. There was a lot of conversations around integrating innovative solution related to even technology. And when we think about access to information, a lot of individuals have it at their fingertips. So ensuring that there is accurate information, and there's a lot of conversation around vaccination hesitancies. We are seeing a decline. Well, why is it that there is a decline? Why is there hesitancy? So I think that there's importance in addressing some of these issues, and why is it that we're not uptaking something that's low-hanging fruit and very easy and accessible, and it saves lives. And so I think that accurate information, because there's a lot of misinformation out there.
And just going off that, what other areas do we need improvement, or I guess where do we go from here?
Yeah, a great question. I think the biggest piece is, we've been talking about the importance of prevention by vaccination, but what is the hesitancy? Why are communities not wanting to vaccinate? Because it is everybody's responsibility. It starts from an individual level. It starts from family. We talk a lot about power, and that was one of the keynote speakers. He talked about power, but with power comes responsibility. It's a privilege to have power, but understanding how you use your power. And so I think nurses are a very trusted profession. We have accurate information, but we can always have the power of having a conversation and understanding where that hesitancy is. So I think we need to have those conversations. We need to understand why our communities not vaccinating. What is the hesitancy? Really get to the root problem, because information is out there. And as I said, this is something it's prevention. It's saving lives. Why are we not saving lives? Why are we not saving our children from this disease that's very preventable?
Zara Shajani, University of Calgary's Associate Dean with the Faculty of Nursing. Thank you so much for your time this morning.
Thank you. Thank you.